Okay, we'll convene the meeting of the Dubuque County Board of Supervisors. This is our special COVID-19 meeting, Monday, October 5th, 2020, 10 a.m. We have staff at the courthouse in the board chambers, fourth floor of the at the courthouse, and it's being conducted via Zoom. And we'll go to the agenda. First item on the agenda is our work session to discuss COVID-related issues. So with that, unless Ann McDonough or Jay Whitcomb have any opening remarks or comments, we'll go to Patrice Lambert for her report.
Okay, good morning, everyone. Can you hear me? Whoops, sorry. Can you hear me?
We can hear you.
Okay, good enough. Well, good morning. I'll just start by informing you that Stacy Killian is not able to join us this morning, but I believe Tom Berger is on. So I do have Stacy's report, which I will share as well. So again, with the numbers in Dubuque County, I'll just briefly mention those from our dashboard. In Dubuque County, we've had 31,344 individuals tested. Out of that number, we've had 3,701 that have tested positive. Out of that number, we've had 2,213 that have totally recovered, or that have recovered. That's our total number. And then, unfortunately, our deaths did increase to 44 deaths. We are looking at a positivity rate in Dubuque County. Today, it's at 15%. Yesterday, I believe it was 14.6. So today now it's listing as 15%. Our age group for our positive rates are still looking at that, oh, I just had it up here and now I've lost it. It's still looking, here it is, at that 18 to 40-year-old age group, which is consistent of basically 47% of our population that is testing positive. Our next age group is at 41 to 60, which is looking at 25% of all of our positive cases. We are looking still at the majority of our positive cases, 61% are showing signs and symptoms. Let's see here. We have two test, which as you're aware, two test sites available in Dubuque County. The one we continue at Epic Health and Wellness, and the second is with the Grand River Medical Center on University Avenue as well. I did send, is Dawn on? I did send Dawn just a quick PowerPoint that I was going to share with you.
Patrice, this is Supervisor Baker. Dawn is not available today, but if we could send that to Nathan Gilmore, I think he could, if you want it up on the screen, I think Nathan could take care of that.
I will Patrice, do that right this.
Yeah, if you email that to me right now, I can share it.
I will do that right this minute. Hold on. Sorry about that. Yeah, usually Dawn responds, and I didn't hear anything, but I just thought, okay, hopefully she has it. So, okay, it's a real short one, so sorry about that. Okay, Nathan, it's coming your way. Modern technology, I love it.
And we've got the guru, we've got the IT guru on top of it today.
Yep, which is good. Thank you, Nathan. And did you get it yet, Nathan?
Patrice, if you want, maybe skip over that topic and come back to it.
Absolutely.
Give Nathan a chance there. Yeah.
I will do that. Yeah. I can report a little bit from Stacy. Stacy said that they have gotten 642 calls and contacts to families through the school contact tracing. As you'll recall, Stacy and her staff continue to follow up with all of our positives, even though Iowa Department of Public Health is doing that for us. But with the school setting, Stacy does follow through with all of our school contact tracing. And again, always asking if they're safe, can they isolate or quarantine at home, and then does discuss our sheltering apartments if needed. We do continue to meet on a weekly basis with our shelter manager, and we do have people actually in our shelter apartments this week as well. We did last week, and a lot of those people were discharged, and we do have a couple in there now. Let's see, Stacy also states that we've had 2 long-term care outbreaks that are continuing, and the Visiting Nurse Association does provide daily contact with them. Out of all of our contact tracing that the Visiting Nurse Association does, as you'll recall, we do have some testing kits available, and we work through a healthcare provider, and we have offered 281 individuals testing through that contact tracing with those tests that we had received. And then for the total calls and contacts through the Public Health Call Center, VNA has now received 21,861 calls. The incident management team has also been looking at promoting our influenza vaccination, because we do know how important, especially important, it's always important to encourage people to get their vaccine this fall. Actually, you can start right now. Some of our pharmacies do have that available, so we are encouraging people to go ahead and get that influenza vaccination now. We do receive a weekly report from our Iowa Department of Public Health, our epidemiologist who oversees the influenza program itself. And he had stated on Friday that statewide our activity is still at a low level, but geographically across the state of Iowa, the influenza rate is sporadic. So again, it's not too early, and it's not too late to go in and get your influenza vaccination. We're also still looking at our DOMO program. One of the Board of Health members, Diane Pate-Freiberger, did have a request, which we'll be working on this week, and we will be showing that at the Board of Health meeting. She's wanting to look at, and we don't even know if it's possible yet, but we will look to see if it is, looking just at our age group with a positivity rate utilizing the zip codes. So we are learning more and more each day on the DOMO program itself. And the incident management team, again, has been very, very busy working with our healthcare providers on our COVID vaccine point of distribution plan. We do know that we could get vaccine as early as the 1st of November. We know it's going to be a limited amount, and we don't know if Dubuque County will be one of those recipients, but we do have to have a plan in place. So we have been working with our healthcare providers, and we will start looking at our retail, such as our pharmacies, as far as once the state does receive the COVID vaccination, if we can have it shipped directly to those providers to start the distribution. And again, I know I've said this probably weekly, but each vaccine that we're aware of, vaccine A and vaccine B, do both require a second injection. So people will have to come back after they receive their initial dose with vaccine A after 21 days and with vaccine B after 28 days. So we're still answering a lot of questions, or actually learning for some of those questions that are given to us by our healthcare providers. But we've been working closely with them, and with the hospitals. And I think our plan is we'll be ready to go. So, and that's a good thing. So then I see Nathan does have the PowerPoint up. The first slide is I just wanted to show if I'm hoping everyone does receive the Incident Management Team Public Health Update that Randy Gill does for us on a daily basis. He does a super job. And this was just one step that we were able to go from the DOMO program with the towns and their positivity case. We were able to look at a bar graph for the percent of the population by the zip code. And again, we will be updating that zip code, and that'll probably be updated Wednesday night for the Board of Health meeting. So we can share that at that time. So then Nathan, if you could go to the second slide. This has been, last week, this was pretty much our focus, working with the school districts and with the higher ed. The incident management team heard of the new guidance that was issued by the governor, which she presented to the public on Tuesday. And with that new guidance for the quarantine, well, you can read it right off. There was a change in the definition for the state of Iowa in the definition of close contact for the purpose of the contact tracing of the positive COVID cases. CDC has, as you are aware, has defined close contacts with a positive case as a person within 6 feet of each other for 15 minutes or longer, regardless of mask use. Well, the state of Iowa on Tuesday decided to look at that definition, and what they had informed us is that if both individuals are wearing masks, and again, this is for non-residential and non-healthcare settings, regardless of the distance or duration, they would not be considered close contacts. So Nathan, do you want to go to the next slide, please? Then we did look at all of the masks and the face coverings from the CDC. And we looked at, which masks should be used and which masks should not be used. And here you can see the pictures of those masks that they should cover your mouth and nose, should have 2 or more layers of washable, breathable fabric, and they should fit snugly against the side of your face and not have gaps. And again, those masks that should not be used are the hard fabric, such as the vinyl. Let's see, okay, the vents are the valves on the side which allow the virus particles to escape. And they're not recommending the N95 respirators or surgical masks for the general public. So then Nathan, if you'd like to go to the next slide, please. So we had a lot of discussion with the school districts if gaiters and face shields would be considered viable face masks to meet this new definition from Iowa Department of Public Health. And the Iowa Department of Public Health and the CDC advise against wearing gaiters and face shields. So if we were to have a situation in one of our schools that both children or students were wearing face masks, if one was wearing a gaiter or a face shield, then the new guidelines would not apply, because the gaiter and the face shields, there's just not enough research on these to know what the effectiveness is at this time. So Nathan, would you like to go to the next slide, please? So what the incident management team will continue to do is that we will still preach or strongly verbally say with our mitigation strategies that we still recommend people maintain that 6 feet of physical distancing between others, regardless of any mask use. the decision to implement this guidance, the new guidance that we have from the governor, is really an individual school decision. The incident management team will follow the guidance that individuals that do have a close contact with a positive case must still quarantine when either the positive case or the close contact were wearing a gaiter or a face shield instead of a mask. And we do know that Holy Family has announced that they are not going to follow the new guidance, that they will still have us utilize our current guidance of the contact tracing. But with the Western Dubuque School District and Dubuque School District, they are still trying to determine which route that they will go with this guidance. So right now, the incident management team is going to basically still continue with the guidance that we have always followed, that even regardless of the mask, that people will be isolated if they're positive, quarantined if they are wearing a mask, unless, of course, the school district decides to follow the new school or the new state guidance, and then we will abide by their decision, and we then will again isolate the positive, and then if both the positive case and the contact tracing person is wearing a mask, if it's not a gaiter and if it's not a face shield, then the contact tracers will not have to do the quarantine itself. So then, Nathan, the last one. Again, if people are interested in learning more about the masks, we just put up a link for that. So, any questions on any of that?
Teresa,
None for me.
Okay.
Ann, did you have a question, please?
Yes, I do.
Okay, go ahead.
Oh, sure.
Patrice, the zip code information is, in today's world, quite old. When will we be getting updates? I'd like to see them happen at least at minimum every Monday when we have our meeting. Is that going to be possible?
Yeah, and we're having our Board of Health meeting on Wednesday, so we'll present the updated one on Wednesday. And then I don't see why it would be a problem to have it ready every Monday. We'll try to, but this week it'll be to the Board of Health meeting.
Right, and what the cities are looking for is their case count, not the graph you have here, which is percentage of population by zip code. Because if you look at percentage by population of zip code, all those numbers other than Farley and Epworth actually look pretty good. Aren't they in the target range? Which is, you know, I mean, it makes it look like everybody in Sherrill and Balltown's in good shape. It's only 1%, 1.9% of population. So, I mean, I'm not sure we have a target number of percent of population. Those numbers look, you know, deceptively good.
Yeah. And this was just to show an example of what we can do with the information that we get off of the Domo. So yes, we'll do
right. The other thing that would be incredibly helpful is to know about the age group that is college traditional students. When I look at the zip code information for 52001, that comprises nearly half of the cases in Dubuque County, and that is where all of the most of the institutions of higher education are. Who's monitoring that? Who's monitoring whether or not they have an outbreak status? You know, who's kind of got the pulse on that for us?
And we are meeting with a higher ed. We were meeting weekly and then we went to every other week, but now we're back to weekly meetings with them. And Stacy and the communicable disease nurses are doing contact via phone with those higher eds as well. So we are keeping a close eye on that population as well.
That sounds like exactly what you're doing with every population. What are you doing different with regard to the institutions of higher education?
What we did last week was with our shelter apartment enrollment increasing, we did work with a higher ed to again look over their plans for having like a wing set up or certain rooms that had a bathroom hooked up with that room, in case we did have more cases appearing and that people were not able to isolate on campus. So we did really look at that isolation component with the higher ed. And now with our meeting tomorrow that we'll have with them, we're going to be going through all of the new guidance, because they too will have to determine with the new quarantine guidelines which route that they wish to go.
In the contact tracing and in the information that you know but cannot share, which is about specifics as to what areas of the county are having more cases appear, who can help us determine where we might want to be on the ground, so to speak, dispersing face masks to communities that maybe don't have easy access to them in the 52001 zip code specifically? Could you help us be more specific, such as 20th Street area or, you know, Asbury Road and Cheney? Could you be more helpful with that?
That's a good question, Ann. We can look into it. Yep.
Thank you.
That's a good question. Sure.
Okay, any other questions for Patrice Lambert? Okay, thank you, Patrice.
And thank you, Nathan. Thank you.
All right. Okay, so we'll move to the next item on the agenda, excuse me, which is our Sunnycrest Administrator update. And Chris Kirsch is still here to assist us, and we're very happy about that. So go ahead, Chris.
Good morning, everybody. I'm like a
Good morning.
So, Friday, Saturday testing. We tested all the residents and staff. We tested 107 staff. One of those staff members was positive, both on our antigen machine and our PCR testing. And then we also had one resident test positive. So that resident is our only resident in the COVID unit. Can I get a big clap? Yay!
All righty.
So we have 4 residents in level 2 isolation. So they're just kind of, those are the residents that are kind of on the edge that we're kind of watching. And then we have 3 residents in level 1 isolation that could have been in contact with these other 4 that are kind of on the edge. So 3 people in level 1 isolation, 4 people in level 2 isolation, and 1 person in the COVID isolation. Yay! We will be doing focused PCR testing tomorrow and Wednesday of the residents and the staff in that area that that positive resident came from on Tuesday, Wednesday. We'll send those to the state hygienic lab. As the supervisors noted, those results came back within 24 hours. So I'm quite hopeful that we'll get a quick turnaround. There'll be more tests being sent to them, so it might be closer to a 48-hour turnaround, but we're gonna try to nip this in the bud. And then the rest of the staff and residents we'll use our antigen machine on them. So otherwise, everything's good here. Our one COVID nurse went home this morning. She packed up from the camper and actually went home to hug her little one. So I think that's about it for my report.
Thank you, Chris. You are much appreciated.
Thanks.
All the hard work that's happening at Sunnycrest and wonderful care, but to you personally, I thank you for your service beyond.
Well, you're quite welcome, and the team here is just amazing. So we really worked hard Saturday to move the isolation unit, and kudos to the entire team here.
We have a dedicated leader and dedicated staff at Sunnycrest Manor for sure.
For
And that's from the direct care staff and all the support staff included, because they're all part of the team.
For sure.
Yeah. Chris, I had a question with the governor's change with regard to isolating. Does that have any impact on long-term care facilities?
No,
Are we changing anything?
no.
Okay. All right. Okay, thank you. Do we have any other questions for Chris Kirsch? Okay. Thank you, Chris. Thanks for the report.
You bet. See you next Monday.
All right. Okay, next up will be Tom Berger for our emergency management team update. So we'll turn it over to Cheese.
Good morning, Dave and supervisors. I don't have much more to add as far as the incident management team or from what Patrice presented. The one thing with the end of the month, we did just kind of an item of note since this started, kind of some numbers that we did hand out over 21,000 N95 masks, over 91,000 of the surgical procedure masks, 8,300 of the face shields, and also 36,000 gowns since the start of the pandemic. So we're still getting support from the state for equipment for long-term care facilities and fire EMS agencies. So that's still coming in. Most of my requests now are coming to support both of the both Epic and the Grand River Medical Group for supplies, testing supplies for them. So I think everything's going well over there with them. So they'll receive another shipment of Kelly at Epic is good for this week, but she did receive a shipment last week, and then Grand River Medical also. We're going to be giving some more test kits, probably be arriving Wednesday to get them through till next Wednesday. So I think the test sites are going well. So that's really all I had, Dave.
Okay, thanks, Tom. Question, as you provide PPE for Dubuque County providers, are you having any trouble backfilling then and keeping the inventory up to an acceptable level?
Not at this time. We really have two different supplies out here, and it's just, I mean, there's one supply, but keeping track of it, because some of them that you have purchased, with that initial allocation last spring, we're able to use them for whatever you see fit. The ones I received from the state obviously have a targeted area they have to go towards, so I'm kind of keeping that separate. But at this point, I have not had in this fiscal year any need to purchase anything additional. Most of my requests are coming from eligible healthcare facilities. We're able to obtain it through the state. Might not be exactly what they want. There's a different kind of gloves now seem to be the difficult thing. We can't get the nitrile gloves, but they do have an alternative synthetic glove that will work in the short term. So that seems to be the big shortage thing now is gloves.
Tom, have you had to tell any of our Dubuque County providers no on any PPE?
Well, not really PPE. Some early on, we tried to get some of the disinfecting wipes, and those are technically not considered PPE, but those are still kind of in short supply, or they're out there in the community, but there's a limit on how many they can buy, so they're better off obtaining those on their own. So, but as far as PPE, no.
Okay, thank you.
Yep.
Any questions for Tom Berger?
Tom and McDonough, and I think this is a good time to bring this before my colleagues as well, so that we're all on the same page about the supplies, the surgical masks, the disposable masks that we have in our county purchase. About how many of those do you think we have left?
I can get you the exact number, Ann, but there should be, there's over 30,000 of them.
Right. And recently, I know, and you're very kind today, seeing that I get maybe 4,000 of those today. What I've begun doing, and is to try to intersect where we know individuals in the city of Dubuque primarily don't have easy access to face masks, by reports that people are giving to me, and just general observations from myself, where, as Diane Hyken says, secondarily distributing those, repackaging them into Ziploc baggies of 3 or 4 face masks, and putting those in places where people would find them and maybe have access to them. So we know we have surge situation throughout the county, but certainly in the city and in 52001. So placing those in the little libraries, the free libraries, where even peanut butter goes, folks take those products. Also, just trying to find targeted areas. I did have a conversation last Friday with City Manager Mike Van Milligan, and he said I wanted him to know that I have my nose, so to speak, in his business, and am trying to find a way to maybe better intersect with folks who don't have face masks. There's just some barriers for individuals in parts of our city that individuals may not generally be aware of. But first I want to know that I think I have about 800 total masks out in the community right now. In Dubuque, if you needed a face mask, you can always go to a fire station. And that's what the city manager told me on Friday.
Yep,
I
that's
actually
correct.
didn't know that myself. And then otherwise the Jewel, if you get onto their transportation system. And then of course from law enforcement, before they would issue a citation for not wearing a mask, they would offer you one. So, you know, just generally, that's kind of what I've been doing. And I guess this is the time to have comment about that. If that's a good use, a bad use.
Right, and I did mention that last time when the question came up about the Walgreens downtown, that the fire and police do have masks, and actually last week they did pick up some more for the fire department. So those are out there. I mean, that was one of the things the city wanted to make sure, you know, that it was going to be an education, and they're going to have them available for people that didn't have them. So police, fire, and the Jewel, like you said, do have masks available, as well as if a lot of the businesses make them available, you know, for their customers when they walk in as well, if they don't have one.
Right. So the question is who's coordinating this? Is that your office? For instance, are they available if you focus on certain areas of the city? I don't believe the grocery store hands them out. That's a Hy-Vee only kind of thing.
No, if they come to me for requests, I can get it to them, but I'm not working directly with any of the local businesses.
Right, and that's what you know, the city manager in Dubuque indicated to me too. There's no one coordinating the city's response in terms of, he's just obviously, if those 3 intersect points need them, the Jewel, fire departments, or police station, they would be, you know, finding supplies. So, but I would ask my colleagues if you think that's an inappropriate use. I mean, I have asked Tom for these. I've delivered many packages to the cities, the municipalities who asked for them, but the repackaging and putting them out for individuals, I know from my work with the Red Basket Project, sometimes you just need to place necessities where people are when they need them.
Supervisor Baker here, and I applaud your efforts and Diane Hykins, I think it's totally an appropriate use of these masks. So thank you.
And I don't know if anyone from the health board would have interest in assisting with that. But, you know, I'm keeping the best records I can to move forward, but it seems we shouldn't have 30,000 sitting on a shelf that we've paid for since March and not be trying to distribute them somehow. The tri-state area medical mask community, which makes the face masks of cloth, and they've done a brilliant job. They have kind of concluded what they are doing and reduced their hours quite significantly, and they're responding to specific requests. So I might help coordinate that with food distribution points as well.
Okay, thank you, Ann. Great report. Good questions. So Tom, with the approximately 30,000 left, how do folks in the community access those? Are those being given out to healthcare providers, or are they available if a store would like to have those and give those out? What kind of rules do we have for accessing those masks? How have we been doing it?
Well, so far there hasn't been any rules as far as, I mean, however you guys want to spend them, you're the ones that paid for them, whatever works. I mean, we've been giving them out to the municipalities that asked for them for distribution to their communities or their events or their citizens. Now the healthcare ones, that's the ones I'm keeping separate because the state will provide them for the long-term care, and then the other ones. So we keep the other ones available for whatever you guys, it's at your discretion, really. So.
Okay,
I guess.
I just can't imagine us saying no to a reasonable request, but maybe we do need to have more discussion about that. But I think the big thing is, because didn't we start with 50,000? We're at 30 now, so we don't know how long.
Masks are, they're readily available from companies right over in Chavanel Road. They had over 200,000 that are available for businesses and anybody to purchase as well as they need. So I guess you'll have to decide, how much, where do we want to drop them off, or, if there's food delivery places that'll take them to the people. I mean, we'd be glad to give them the boxes to do that. I mean, I just don't, with one person office, I don't have the means to get it out to everybody.
Right. And I did ask Labor Harvest, Dave. Tom Townsend and I have talked a couple times about this idea of taking them out of their large packages and obviously, careful, clean environment, but putting them into Ziplocs. How would we do that? The urban bicycle folks are handing them out on their route now. This is the second Sunday they've gone out. Just trying to intersect again where we, I think in my middle class world, they're available everywhere. I can purchase them pretty, I can purchase them black and white. I mean, it's whatever I want, pattern, assortment, preference, but that isn't the case for folks who are asking for food because they can't afford that. So just trying to identify and then work with those individuals to get those masks. I mean, honestly, I hope Mother Earth forgives us. We're taking disposable items and I'm putting them into plastic. But at this point in Dubuque County's history, I think what we do to step up our game is going to be better served if we can intersect in some better way. So anyway, it's, I apologize. It's not supposed to be about me, but I wanted to make sure that my colleagues know that that's being done. If you have any hesitations about it, then this is the opportunity to follow up now or let Tom know if I'm stepping somewhere you'd rather I don't go. I did connect, like I say, with the city manager to make sure he knew that I was, taking some steps there.
Appreciate it, Ann, and I will talk to Tom as well as a board member and volunteer, and we deliver Tuesdays, Thursdays, and Saturdays, and I've been to every corner of the county delivering groceries. So I think that's a really good idea. I'm sure with Tom, you know, his first priority is getting the food out, but perhaps, you know, some of our board members and maybe we can get some other volunteers to do the mask, you know, bundling up some masks to get out to folks. And it's probably something we wouldn't have to do, you know, every time, but maybe on occasion. But I think it's a great idea. So, all right. Any other questions or comments regarding Tom Berger's report for emergency management team update? Okay. Thank you, Tom. All right. Next up on the agenda is the testing update. And with that, we'll go to Ed Raber for his report.
Thanks, Chair Baker. This is Ed Raber. A couple things I wanted to point out. If it's okay, there's a note, a couple agenda items down about Dubuque County municipalities. I was actually going to just going to run through a little bit of that first, if that's okay with you. That was me too, I believe. Over a week ago, at your request, I sent out a note to all the cities, their city clerks or administrators or administrators and the mayors, asking if, you know, what has been their response locally about masks or other things talking about COVID, and have been pleased to receive a number of responses. I think we have discussed those in the past a little bit, but just to run through those again. Sageville has discussed this. I believe that the city council has indicated that they're behind that. They didn't pass a formal resolution for their 100 residents, but that was their discussion point. The city of Cascade has also done something similar. They've discussed it. It's been in the paper. They did not pass a formal action, but that has been their discussion point, led by Mayor Stainer. Also in Worthington, just up the road, Worthington actually did pass a recommendation for that. That was largely based on language that we had drafted here at the county. The city of Asbury also passed a recommendation, and that was based on language that we had helped to develop, and we got that from someplace else. I don't want to say that we developed the language, but we put it in a format that they copied. Received that from Beth Bonds, city administrator, and also the city of Piasta. I've had some correspondence with Mayor Merton. They have also discussed it at their city council meetings, and they have not passed any formal action, but it has been a deep discussion item there. So I've actually reached out to the city of Farley, which is one of the Mayor Gassman, I think, was on the call here. So I don't want to leave out Epworth. I apologize, but I almost overlooked Epworth. But Epworth also has had this as a discussion topic, and I believed also took some formal action to recommend that to their residents and businesses. So I have reached out to the mayor and clerk in Farley. I just haven't had an opportunity to talk with them. But those largest cities and some of the smaller cities have been making this an agenda item and discussing this. I believe that from the correspondence or conversations I'm having with them, they believe that this is, they're taking an action that is the one that they feel is the right one for their community to reach residents and to try to shape future behavior and get people on board. So we'll wait to see how that works out, but that's the correspondence that we've received from those communities. Of course, I left out the city of Dubuque, which has already taken some formal action that you're aware of. In regards to testing, as you know, beginning a week ago today, the state added a second Test Iowa clinic in the community. I'm going to try to share my screen if that's okay. Can I do that, Dave? Dave?
Yeah, go ahead, Ed. Nathan, Ed would like to share his
I got
screen
it.
here.
I got it. I can do that. So hopefully this is dynamic. This is the state's dashboard, and it's only for Dubuque County that we have highlighted here. I'm sure you've all done that. Gives comparative numbers for total historic positive test results. If you look at the testing in these little screenshots here, it shows that in Dubuque County, we're one of very, very few counties that has achieved about 1 out of every 3 residents has received a COVID test in our county. You can see here in this individuals tested box, which in my opinion should be called new individuals being tested, not the total number of tests that have been administered in our community. But the tallest day here was back, this was one day that we did a lot of the initial testing at long-term care facilities and things. And so those people showed up for the first time there, and there were over 900 that day. Right after the July 4th, and if you didn't know that you could do that, if you just like take your mouse and kind of highlight over a window of dates, it'll bring those to the fore. Right after the July 4th weekend, there were many days that had over 400 tests. That was just a short time, maybe a week or two after Epic Health and Wellness had opened as the first Test Iowa clinic. My conversations with other private medical clinics was that they were doing a lot of testing during this time because public demand was very high right after the July 4th weekend. And then as you can see, toward the end of July, that tapered off. You can see that demand kind of had bottomed out there where we were only having a couple hundred tests a day. And for most of September, I just want to remind you that the testing levels had really started to rebound, primarily because of public demand, just signing up for more tests. So we were routinely, again, just like in the beginning of July, for most of September, we were routinely having multiple days a week where testing was over 400 new tests a day. And this last group, this last week, you can see the low 2 days, there's a scalloped shaped each week, and that's the weekend. With the addition of the new Test Iowa clinic at Grand River Medical Center, in general, that's added about 100 new tests a day. So that's what's happening in Dubuque County. Roughly 100 more people per day, at least during the work week, are being tested. So I'm not saying that they're only doing 100. I'm saying that the net result of all these different options is resulting in probably about another 100 people being tested a day. So comparatively, that is pretty significant compared to most of the other metro areas that are considerably larger than us. So there's a lot of testing. If you were to look at what's going on with positives, that's also, I think the test demand goes hand in hand with the positives that we've had. I think that there's been more concern after Labor Day and an extended period of time after Labor Day where we're finding more positives. So that is the situation that we're in. I've also had some conversations with our Test Iowa clinics just to make sure things are going okay for them, and look forward to more conversations coming up here. So in terms of testing, that's where things are. I think that there's another testing day that still is just about ready. That provider is going to announce it, not us. But one of the pharmacies is looking at doing a remote site in another part of the county that would just be a one-time, or at least not a regular thing. It may happen more than once, but they're looking to do something to provide some additional testing where their office is not doing that. There is another medical clinic in that community that is doing testing. So there's a variety of things going on with that, but that's how I would benchmark where things are. We're having days where we're hitting 700 plus new tests a day, and lots of days with 500. So that's a lot of testing. So hopefully that is working for the residents of Dubuque County. And as Patrice said, part of this is also the contact tracing that's that they're using some of their Test Iowa test kits and a local medical provider to make sure that that people that need contact trace testing have that near them. Did anybody have any questions about how those things are shaping up, or how that is moving forward? Our situation, perhaps even compared to some other regions, or other things that you've heard?
Ed, Dave Baker, do these numbers, and this is very helpful, and I'm really pleased with the way you've explained it, but do these numbers include the Hardig's and Union Family Pharmacy numbers? Okay. Thank you.
It includes them, and it also includes any Abbott tests, any antigen tests, like what Chris Kirsch was just talking about at her facility. So really it covers the gamut of that.
And this is Ann McDonough. How is it that you think that nursing home tests are in here?
Because they have to report them as well. But going back.
You bet they're reported, but that doesn't mean they're on the dashboard. Senator Rob Hogue, former Senator Rob Hogue, and I discussed that over the weekend as well. We don't know where those numbers are being recorded.
I think that they are, Senator Hogue and I actually talked about that a little bit too, a couple of weeks ago. They're in there. I'm going to go, I draw your attention, if you can, back to this individuals tested box. I don't know if you can see my mouse or not, but in this individuals tested, back at the beginning of July, there was, we had a day that had 911 tests delivered, or conducted, or collected. I think collected is the right word. And that represented one of the days that we were doing a lot of testing through that initiative that Patrice spearheaded to get testing done at all of our long-term care facilities. And so a big chunk of them were reported that day. But once those individuals and residents have been tested, they do not show up again in the testing data unless they test positive. So most of those people on that day, that 911, almost all of them tested negative. There were a number of positives, but most all of them tested negative. So we don't see them again in the data. So the repeated testing that is going on at Sunnycrest and all of the other long-term care facilities or residential facilities that's happening a lot, or at our local higher education institutions where they're testing athletes or they're doing other things, we're not seeing that because most all of them test negative. Some of them test positive, and this is the first time they've tested positive after 5 other tests. That will show up that day. So the individuals tested is really 2 parts. One part is people that have never been tested before, or 2, people that are positive, even if they have been tested before. That's the way I understand it.
That's the way I understand it as well. So where are the folks at Sunnycrest Manor? Let's just take employee number 1 as a hypothetical, and that person may have been tested 12 times. Where are those 12 tests counted?
They are counted in the state's database, but they are not reflected on this chart, Supervisor. So
many more people are being tested in Dubuque County. Many more tests are occurring in Dubuque County. Those are not reflected on this dashboard. It continues to be missing data.
We have exposure to a limited set of the state's data.
Right.
I find that this box called individuals tested is actually very helpful data. It is just not the entire picture, Supervisor.
Right. So when I talked to my kid, who's one of the medicine people, he told me to let go of that. He said, You're not going to get it. You're not going to know it. So just stay with, is the rate going up? And we want to make the rate go down.
I think that especially at the further we're along in this, let's go back to the end of June and the beginning of July when we had our first test Iowa clinic that had opened up here. You saw a much higher correlation between the number when Kelly McMahon, who generously would, drop me a note many days saying how many people went through their test Iowa clinic that day, and you would see that reflected in the next day's data. Since that time, many people have been tested repeatedly, and so the next test that, for instance, at Epic Health and Wellness or at any of the private medical facilities or at a long-term care facility, that next test, unless that individual has not been tested before or this time tests positive, you do not see it in the data. So I'd like to point out that one of the remarkable things that this chart does tell you is that we continue to have penetration of getting new people in Dubuque County tested for the first time. I find that around the state, but also here in Dubuque County, I find that to be remarkable that people continue to come out and be tested. So that's why we've had over 30,000, roughly a third of our population has been tested. And that is a remarkable number that continues to go up at the rate that it is. But total testing, I'm just guessing at this, my educated guess is considerably higher.
Hey, do we have any other questions for Ed Graber?
And
Okay.
I'd like to add the issues that Supervisor McDonough just brought up about some of that coordination. If you didn't really take formal action as a board, but unless anybody has any, I'd be happy to assist with some of those efforts that Supervisor McDonough is kind of spearheading. But if there needs to be any running around or doing some of the things, if that's okay, I'm just letting you know that I'd like to be available to assist with that, along with maybe I don't know if there's some other county staff that I'm not looking that this would be a lot of stuff, but just maybe a little bit of additional coordination and another set of feet delivering some stuff. So unless you have some objection to that, I'll probably work with that and any of the people from the Board of Health or anything that are so inclined.
Well, the one comment I would have, is the city of Dubuque has a much larger staff than we do at the county, and so I would coordinate activities within the city of Dubuque with city of Dubuque staff, and specifically Mary Rose Corrigan. So, we won't be doing justice and help if we do end around various cities. Our role as the county, we have jurisdiction in unincorporated areas. When we're in city areas, we should be coordinating with all city efforts.
That is exactly right, Supervisor Wickham, I agree. And so that, I didn't state that, but yes, our partners that have been great about providing access, including Mary Rose Corrigan and the Housing and Community Development Department and others here in the city of Dubuque, as well as around the county. We have appreciated those municipal partners that have been very open to communicating with me and you guys as well. So that's the way that would happen. Yes, we're here to play a coordinated piece.
Ed, I would ask, obviously, that you coordinate with Patrice Lambert and keep, because, we have staff with our health department. And then we have Tom Berger as well for his input. But, occasionally have to remind folks that, Dubuque County is approximately 98,000, and that includes 21 cities and towns, including the city of Dubuque and everybody from Asbury to Zwingle, A to Z. So I think there are some logistical challenges, and as Ann had brought up, I think that's what like the Dubuque Area Labor Harvest would be dealing with is it's you know, the way they're packaged, they have to be repackaged to be distributed, and for the masks, that type of thing. So,
Correct.
But,
I have appreciated all the coordination and stuff that Tom Berger has provided to me, and I have appreciated the additional staff in the health department. That's been a big help in terms of having people to coordinate with. So,
okay.
Yes, all of those things.
Great. And I think earlier the Ann had raised the question about you know, the appropriateness of getting masks out to people, and I think again it's totally appropriate. I'm just trying to imagine a scenario that we would say no. I think the whole idea is we want to get the masks to where they're needed, and that seems to be a challenge right now logistically, but I don't think there's any barriers for approval, but I appreciate the fact that Ann wanted to know that, and I think let's get them to where they need to be. So, and if you can help with that, Ed, I think that's great. That's and hopefully again we're all on board with that. So thank you for the report. I think you kind of did two birds with one stone there, Ed. So I think we'll go next. If there's no other questions for Ed Raber, we'll go to our Board of Health update with our chair of the Dubuque County Board of Health, Tom Beschen. And Tom, I'll turn it over to you.
Thank you, Chair Baker. I don't have a lot to report today. We did not have a meeting last week, but we have a meeting coming up this Wednesday night. And I saw while this meeting was in progress that the agenda has been published. It is now on the county website. This is our regular meeting. We've changed our schedule because we were off rotation with the every other meeting schedule, every other week schedule. So we will have updates from all of our committees and receive reports from our agencies. So I guess that's about all I have to say. We do have a couple special items under the Finance Committee. We'll be talking about budget for the coming year. And we do have some questions regarding some costs that will be handled by the board and passed to the Board of Supervisors. The other thing I would mention is little did I know in March that we'd still be dealing with this pandemic in October and November and December. But because of another commitment I have with the Senior Health Insurance Information Program from Des Moines, I will be unavailable to attend the board meetings that occur on Monday mornings between now and the end of December. What I plan to do, Chair Baker, is to provide a written summary of the Board of Health activity on the weeks that we have meetings, and I'll send that to the Board of Supervisors Friday afternoon. I will also send the Board of Supervisors the agenda for the week's meeting on those weeks where we don't have meetings. But I am committed to helping counsel Dubuque County residents with Medicare questions for the next 6 to 8 weeks during the annual open enrollment period. So are there any questions?
No questions here, Tom. Thank you for your report, and look forward to the meeting Wednesday night.
Okay, thank you, Chair Baker.
Okay, and I don't know if there's anybody else from the Board of Health that might have any comments relating to this agenda item. I'd like to open that up if there are any. If you would like to speak, raise your hand. This is not the public comments. This is just during this agenda item for Board of Health members. Okay, not seeing any, so we would, at this time then, we do have some other agenda items, and it'll be followed by our public comments for non-agenda items, and we do have Sheriff Kennedy will be speaking during that section. So, okay, we have the next agenda item is personnel requisitions, and we have a permanent full-time maintenance worker 1 position, and I can't see if Anthony Bargett is on. I know Dawn was not able to join us, so I don't know if anybody has any comments on this. It's a full-time position, and it is replacing someone, and the position is budgeted for. So I'd ask my counterparts for a motion on this. Permanent full-time maintenance
Make a
worker.
motion I'll make a motion to approve the personnel requisition.
Second.
Motion made and seconded to approve the personnel requisition for permanent full-time maintenance worker 1. Any questions or discussion? All in favor signify by saying aye.
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 Carried 3-0. The next one is a permanent full-time life enrichment coordinator position. And this is Sunnycrest Manor. And it's, again, it's a permanent full-time, and it is not an increase to staff, replacing someone, and it is budgeted. And again, we open it for discussion or look for a motion on this.
Make a motion to approve the personnel requisition.
I will second that.
Motion made and seconded. Any further discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Okay. Next up, item C on the agenda, we have a resolution for appointment of deputies, assistants, and clerks. And we have 3 positions at Sunnycrest Manor, permanent full-time basic care aide, permanent full-time basic care aide, so 2 of those, and a PRN CNA position.
Make a motion to approve.
And I will second that.
Okay, motion made and seconded to approve the resolution. Any discussion? All in favor signify by saying aye.
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 Aye. Carried 3-0. Next item is a resolution approving the grant agreement with the Center for Tech and Civic Life for funding for additional costs for the 2020 general election due to the coronavirus pandemic. And we did receive a separate email, and then there were documents in the packet as well, but we did receive this, if Denise is on, if we could get her unmuted. She's probably a little busy today, I'm guessing, but with the first day of voting, but we did receive the agreement, and it is a grant in the amount of 20, a grant award application, $23,328 to help with the costs of the COVID-19 epidemic as it relates to the elections, upcoming elections.
I'll make a motion to approve.
Okay.
And I will second that.
Motion made and seconded to approve the grant application. Any discussion?
I actually think it's a grant agreement. The application, I think, has already been, we've already applied. I think we're just accepting the money.
Okay, it does say award a grant. Okay, I saw the, all right. Thank you for pointing that out. It is $23,328. Okay, any other discussion? All in favor signify by saying aye.
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 Carried 3-0. Okay, next up is public comments. At this time, anyone may address the board on matters which are of concern to that person, which are not agenda items. Please go to the podium, or in this case, raise your hand on Zoom or contact us on Zoom via chat, and state your name and address or position. And please be aware that the board is limited in their ability to respond to such inquiries, and Iowa code prohibits the board from deliberating or acting on items not appearing on the agenda. So I'm going to go right to our Sheriff Joe Kennedy, who has requested to speak in public comments on a non-agenda item. Sheriff Kennedy.
Yep. Thank you, Chair Baker. Morning, everybody.
Good morning, Joe.
Yeah, I just want to take this opportunity to recognize someone. I know we have many very good county employees, and they all deserve recognition in their own right. But during this pandemic, we've had some of our employees have had to do probably about twice as much work as normal, in getting things prepared for the agenda and getting all the elected officials everything that they need, and help us look good on a weekly basis. So I'd like to take this opportunity to thank Mary Hobble, who's flying solo in the boardroom today, and wish her a happy birthday.
Well, thank you, Sheriff Kennedy. That was very nice. And happy birthday to Mary. I would sing, but I don't. I'm sure there would be virtual eggs thrown at me. So I'll do that in person when I stop down to sign all of her documents. So happy birthday to Mary. Thank you.
Thank you, Joel.
Very, very nice, Sheriff Kennedy. Thank you. Okay, back to public comments. If anyone would like to speak, just need to state your name and address and let us know by raising your hand or contacting us on the chat function. We'll give a little bit of time here to see if there's any additional comments. Okay, I think Sheriff Kennedy's comments about Mary kind of brightened our day. So way to get a week off to a good start, Sheriff Kennedy. Thank you. All right. If there is nothing else here, I believe that since our next meeting next week is our regularly scheduled meeting, the motion for today would be adjournment. So if someone wants to make the motion to adjourn.
So moved.
Second.
Motion made and seconded to adjourn the meeting. All in favor signify by saying aye.
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 Aye. Carried 3-0. Thank you, everyone. Good meeting, and everyone be well, and Mary Hobble, happy birthday. Have a great day.